Hello, and welcome to Grand Rounds COVID-19 edition, a place where cancer patients can get all of their questions answered by medical experts. I'm your host, Jonathan Sommers. Now, with the death toll in the US from COVID-19 having surpassed 100,000 people, we find this deeply troubling and saddening. We offer our condolences to anyone who has lost a loved one. Today, we're going to discuss mental health. Our first guest is psychiatrist Dr. Scott Hunter. Dr. Hunter, could you please introduce yourself?
Hello, thank you for having me today, Jonathan. My name is Dr. Scott Hunter. I am a child, adolescent, adult, and addiction psychiatrist, and I have a private practice in Santa Monica. I work for the Los Angeles County Department of Mental Health, and I'm very pleased to be here to join you for this important topic. Thank you.
Thank you. We're also very lucky to have Alec Kupelian. Alec, could you please say a few words about yourself?
Yeah, my name's Alec. I was diagnosed when I was 19 with a 19-centimeter long Ewing sarcoma in my left hip. I was very lucky to be treated, and I'm on the other side now. I actually just hit my 5 years in remission earlier this month.
Wow, that's really wonderful. Congratulations.
Thank you, thank you.
Now to our questions. So, social isolation is difficult. Dr. Hunter, why do you think this might be even harder for current cancer patients, their caregivers, or perhaps even survivors?
Yes, Jonathan. I think one thing that's important to keep in mind is that the changing healthcare landscape in these times may be particularly challenging for those who are currently undergoing treatment. I know that the way places that you might depend on, doctors' offices, healthcare providers, and the way they have provided care in the past, of course, is changing, limiting who can attend appointments, limiting how you might be able to contact them. And I think that certainly adds a layer of stress that wouldn't otherwise be there. I think that certainly also applies for survivors who may be looking to a healthcare provider, trying to get answers to questions they may have, and their normal options or normal channels of communication may have changed. And even things like booking an appointment has changed. It's created an opportunity for a lot of providers to expand their telehealth care services. And that's something that I think some people are more comfortable with or less than others. And I think the others who may not be initially more comfortable with that might find themselves, waiting to make an appointment, or otherwise kind of not connecting with a healthcare provider when more and more that option is becoming available. And I think one thing I might say is to inquire as to what options are available from your healthcare provider, and also be patient. Understand that healthcare offices are going through a lot of changes now too, and when you don't immediately get an answer or are not getting the most sort of responsive behaviors from that office, to continue trying and be persistent and recognize that the impacts on the healthcare system are great as well.
What do you think about this?
I can only speak to my experience, and I remember being in treatment. It is really isolating, even without COVID, without anything. When my blood counts were low, I wasn't allowed to go out. I wasn't allowed to see anything. This isolation, this quarantine is something that I was really used to. I went through almost a year of treatment, and I was in the hospital for about a week at a time, every other week. And the things that made it much easier and much better was having my friends come visit. I was very, very lucky in that I had friends who were very active in my treatment and family, and I had visitors come from out of town to come see me. I was very, very lucky in that regard, and it changed the monotony of sitting in a hospital bed every day, hooked up to an IV pole, throwing up into a bucket. I can't speak to how important that was in my experience, and to have a scenario where you are not allowed to even have like some family members. I'm seeing online now so many pictures of cancer patients' families that park in the parking lot. I saw a really funny post on Instagram the other day that was like, COVID got my family tailgating the cancer center. And but that's kind of what it is. You have family members who have to sit in parking lots with posters in order to support the people going through treatment, because the hospital just can't afford to have non-patients in the space. So I can only speak to my experience, but I am so sure that COVID has only increased the fear and anxiety, separate from health, but of isolation and loneliness.
I'm so sorry that you experienced that, but as a cancer survivor, I agree that right now we can't hug our friends, our loved ones, and it makes a cancer diagnosis even harder. With that being said, Alec, you are cancer free. As you know, hearing the words "you're cancer free" is probably one of the most joyous moments. But survivors struggle with getting back to the life they had prior. I would like you to discuss that experience and what lessons could the general public take from that as we are now returning to our lives post COVID-19, hopefully slowly and responsibly.
Very much so. Yeah, coming back to real life, quote unquote, is the hardest thing in my experience for cancer. I always say like, oh, cancer was one of the best years of my life, but not because it was actually one of the best years of my life, but because the year after it was probably the worst year of my life. Again, like I said, I had friends and family members that were super active in my treatment, and I felt so loved and supported. But going back to college the year after, all my friends are a year ahead. I don't know anybody in my classes. I think going back to exactly the way things are was impossible for me. It was impossible for me. Things are not the same after cancer, and reestablishing the same life was impossible for me. I'm sure there are people out there who can do it, but it started to fill me with anxiety and depression, and things got really bad. I started drinking. I was blacking out 3 or 4 nights a week, and I got to a point where I had a bad relationship with my family. And they are, again, amazing and super supportive, and they were with me the whole way. But it was the point where I was sitting in a room, no one was talking, and 30 minutes in, I would stand up and start yelling at them for no reason. And I was very aware that this is just my emotional process and just me. But I knew that I needed help. And so I sought out professional help, and I sought out therapy, and slowly, bit by bit, I got better. And I mean, depression and anxiety is still something that I struggle with to this day. It's kind of like cancer in the way that it never feels like it's truly over. And with depression and anxiety, I know it never really is. I've learned to manage it better, and I have a lot more tools at my disposal. But honestly, for everyone that is, kind of re-emerging from COVID-19, and especially for cancer patients, like, just be aware that it's not the same afterwards. It's just not the same, and it's about finding ways to kind of manage that and adjust to that moving forward. Things I would want people to know about me, and maybe other cancer patients feel the same way, but there are going to be times I want to talk about my experience and times I don't want to talk about my experience. But the things that I never ever want is I never ever want you to treat me differently because of my cancer experience. That's me. It's like, reach out, ask me about it. It's not a taboo subject, and if I don't want to talk about it, I just will tell you that. And again, that's different for everybody. So do ask. I mean, my big advice is like, ask your friends, ask your family members. they'll have opinions and just follow what they say. It's tough because everyone has a different relationship with it.
I cannot thank you enough for your honesty. I'm sorry that you've had to go through that, but I think what you're saying is reflective of a lot of cancer survivors. And thank you for being so bold and so honest. Dr. Hunter, do you have something to add to this subject?
I want to also commend Alec for sharing his experience, and I think that it's so important for people to hear, Alec, what you experience, the magnitude of the stress, of the combined stresses of returning to your life after cancer, and then having to do that in the context of this incredible, great stress that's impacting everyone, will inevitably kind of heighten any underlying anxiety or feelings of distance, and will also, we all have ways of coping, and some of those coping mechanisms can become their own problems. If we're turning to excessively to substances or other habits that kind of then become a kind of part of a perpetuating cycle, leading you to feel worse and worse. That it's difficult to be able to take a step back and look at that and recognize you being in a place where you need help, and maybe that's professional help, and maybe it's also reaching out to friends and family and seeing what you can do to to establish those connections in the best way that you're able. The one thing that I'd also say, Alec, is that your kind of feeling that it's sort of never being the same, and yet focusing on what you control is likely something that cancer survivors are able to draw upon as a strength from the time of diagnosis through treatment and survivorship. You can generally gain you get through the days by remembering that focusing on the things that you're able to control is a way to kind of continue to push through and find that resilience. There's I think there's even like a resiliency muscle that can ultimately be called upon, that may actually be of some benefit in these otherwise challenging times for so many people. Again, just the example you set and sharing your experience and what you're able to do, and also recognizing that it's an ongoing struggle, is really important. So I'm really glad you put it out there. I think it's so easy to judge. You see what other people are putting out there and begin to think about how you should be doing and how you should be feeling, and that those comparisons that you can make when you're seeing other people's experiences and sort of how they might be handling things, and then using that to reflect negatively upon your own experience, really is a common recipe that can lead you to feel worse.
I appreciate you saying that. That means a lot to me. Thank you.
Those points are absolutely amazing. And I would recommend, if anyone is watching this is struggling, and there's no shame in seeking out help, please call a care provider. And as we transition forward, know that by reaching out for help, you're actually making yourself stronger. And you don't have to be alone. With that said, we're going to move on to our fan question. It comes from our friend at Hillary Gone One. No idea who she is, but my friend was recently diagnosed with cancer. What's the best way I can support them? Alec, what do you think?
Always thought, and I've always said,
I'm sorry, could you say that again?
I've always said that consistency and follow through is really important. I started off really bad about asking for what I wanted. And then partway through treatment, I was able to kind of delineate roles. But the thing that helped me most, when my friends or family members would say like, okay, how can I help you? And of course, the first thing I would say is like, oh, don't worry about it. Don't worry about it. Don't worry about it. But they'd keep asking, and they'd consistently check in. They'd say, hey, how are you? Just like want to chat. And the things that made me feel better is like establishing a sense of normalcy. They would complain about the teachers they were having, how much work is going on, whatever their partner said recently that pissed them off. And that was really helpful. I had a couple people who would be like, oh gosh, no, everything is great. I know you're going through a lot right now. And they'd start treating me with kitty gloves. And that was really, in a lot of ways, hurtful. It made me feel even more isolated from them because I didn't feel like they could treat me like their friend anymore. It felt like they were treating me like a cancer patient, and I didn't want to be defined by that cancer patient. So my advice to you, was it Hillary Gunn, would be keep checking in and treat them the way you've always treated them. Like, ask them about their lives, tell them about yours, and if you make a plan, follow through. Absolutely follow through. My sister was great. She's like, look, I can't control the medicine. I can't control the finances. I don't know how to help you. Let me do one job. Give me one job to do. And I was like, perfect. Katya, you're my snack girl. Katya's my sister's name. So I was like, Katya, you're my snack girl. If I'm feeling I want some salt and vinegar Pringles, like she'd go out, she'd get them to me, she'd bring it. I want a McDonald's cheeseburger, she'd go out and get it for me. Whatever I could stomach that day, if I could stomach anything, like that was her job. And that was really, really helpful and allowed me and her to have kind of this special thing. So that's what I would suggest.
Sounds like a great sister.
Yeah, I gotta get those cheese balls,
How about you, Dr. Hunter?
I think there you illustrated there some things that can really come up as challenges in whether it's in any kind of in any personal relationship, whether it's family or friends. And you mentioned persistence. You mentioned recommending that people continue checking in. And one thing I would add to the persistence is patience. That you very well may come across some displaced anger. I think that we come across displaced anger in these times of COVID, as well as you might with someone who's going through any severe illness such as cancer. If a friend, if your friend is pushing back or yelling at you, respect their requests and what they're asking of you, and then don't be afraid to check in again, in a way that's of course sensitive to them. Be patient with your friends. Be patient with what they might be going through, and how that may be affecting them. I like also the example you gave about how you gave your sister something specific to do. And I think that is something, there's a tendency of a lot of people to ask, what can I do? Anything you need, just let me know, which is kind of really puts it on you then to tell them, which is really quite difficult. And I think in that example that you gave, even your sister was helpful in the sense that she said, no, just give me one job. If there's something I can do for you on a regular basis, let me know what that is, and then that'll be my thing. And so she even just with that narrowed down for you, how that was a very effective way to ask you how she could help without kind of just laying it all on you. And then I also think reflecting on the friendship and the relationship that you've had before, and recognizing that's what will really bring your friend value. What did you enjoy talking about? What did you enjoy doing together? How can you continue to bring that to your relationship? How can you take the responsibility of continuing those things that brought you joy together, and then continue to bring that to the person? Again, like you said, Alec, to offer a sense of normalcy, to say, look, like, we're friends despite this diagnosis, despite this treatment, and that's where the strength really lies in that relationship.
I think that's great advice. Thank you both for being part of this episode. I know it's going to help a lot of people. Before we end, we just want to give a shout out to the class of 2020. Perhaps you didn't get the high school graduation, college, medical school, whatever school, but you did accomplish something. You should be acknowledged and go on and do wonderful things. So that's all I have. Thank you. And
Thank you.
take care, friends.